Sports Nutrition Concepts and Applied Strategies by David Pearson, Ph.D. and CSCS with distinction.
This presentation is entitled Sports Nutrition Concepts and Applied Strategies. We want to begin today with the description and value of the 6 classes of nutrients. The 6 classes of nutrients you've probably heard of throughout your entire career and shouldn't come as a surprise. Proteins, carbohydrates, fats, vitamins, minerals, and most often forgotten, but in sports most important, water. Let's begin with proteins and their functions. Proteins are structural components of all cells. Find them in the cell walls. We find them in most of the structures upon your body. 2 of the most common are your hair and your fingernails, along with your skin. One that's most important for exercise are the contractile proteins found within muscle, actin and myosin. They are also catalysts or enzymes for biochemical reactions within our cells. They form precursors for hormone synthesis, and their energy source is 4 kilocalories per gram. It is an energy source that can be utilized by the body, but it is the least preferred, with carbohydrates followed by fats and then protein. Proteins are classified as essential and non-essential. And while there is some debate as to the exact number, generally 13 non-essential amino acids are identified and 9 essential amino acids. Well, what are the difference? Non-essentials can be produced from food that is consumed in the body. They are incomplete proteins and generally come from a plant source. The essential amino acids must be consumed in the diet. They are complete proteins and are of animal source. Egg and milk proteins are good examples of this. Carbohydrates. They are involved in cell adhesion and structures. They are involved in activation of proteins and enzymes and have an energy source of 4 kilocalories per gram. Carbohydrates are our primary source of energy within the body. Classifications of carbohydrates. We generally talk about sugar, starch, and glycogen. But when we break them down in terms of what these are, we talk really about monosaccharides or simple sugars. Examples of these are glucose, fructose, and the milk sugar, lactose. When you combine 2 or more simple sugars, you get oligosaccharides. Examples of this is common table sugar, which is glucose and fructose. A polysaccharide contains more than 10 simple sugars, and a very powerful example of this is glycogen, which are stringed branches of glucose. They are the stored form of energy within the liver and the muscle. And finally, fiber, an important part of our diet, but cannot be digested, and is used to make the digestive tract run smoothly. When we think about carbohydrates, we also think about metabolism of these. It is very important to remember that regardless of the form of carbohydrate eaten, the body must convert them to glucose in the liver before they can be utilized by the cells. So when we're talking about blood sugar, we're really talking about the amount of glucose that is available. This causes confusion when we look at food labeling, when we see total carbohydrates versus sugars. When we're talking about sugars, we're talking about the amount of simple sugar that's contained within a product. Why is this important to us? It's important to us primarily for looking at the glycemic index of foods. Now, I would ask you to look at a chart that can be found within the textbook for the simple glycemic index of different foods, but let me tell you what it is. It is the amount of reaction that takes place between sugar and insulin. When glucose enters the bloodstream, insulin is released. The amount of insulin in relation to the amount of blood glucose tells us our glycemic index. It is based upon the digestion of white bread. And the glycemic index of white bread is 100, meaning that it's very high, meaning that when we eat a piece of white bread, it causes a high insulin response. Normally, this is not something that we want to have happen in the body. We want to have a slower release of insulin, a slower release of blood glucose. Thus, we want a number preferably under 100. I would ask you to look in your textbook at the chart of glycemic indexes. There are numerous foods that you eat daily. Some may surprise you as having a very high glycemic index. There are only certain situations where we want to have a high glycemic index in our food, and that'll come later in this talk. Again, many foods have high glycemic indices, which may be contraindicated for your clients or your patients that have diabetic conditions. Well, what happens if the body doesn't have enough glucose, which is rarely the case? But in some of today's fad dieting, we do see restrictions of carbohydrates. And in the athletic model, that may not be advantageous. If the body needs to create glucose from other sources within the body, that is gluconeogenesis. While it does not happen often in a starvation state or in very low carbohydrate diets, glucose can actually be formed from proteins, for instance. Fats are structural components of the cell membrane. You can all remember discussing the bilipid membrane or the phospholipid membrane, and fats occur in almost all cellular membranes. They also are a vital cushion for your internal organs. No matter how hard you diet, you're still going to have internal fat. They also absorb and store some fat-soluble vitamins. While this is generally not a problem, it could be problematic in a high fish diet, for instance. They also are precursors for all steroid hormone synthesis, and fats have the highest energy associated with them of 9 kilocalories per gram. However, carbohydrates are still the preferred energy source in athletic movements. As with carbohydrates and proteins, fats are classified by their physical structure. We have saturated fats and unsaturated fats. You hear a lot about this in advertisement. Saturated fats are solid at room temperature, much like butter, and come from animal sources. Saturated fats are least desirable in our diet. Unsaturated fats are liquid at room temperature, much like corn oil or olive oil, which is a preferred unsaturated fat. They come from plant sources. When we look at the chemical structure of fats, we have 3 different classifications. Triglycerides, which are primarily found in the food we eat, cholesterol, which is the basis for all steroid hormones, and phospholipids, found primarily in the cell membrane. Vitamins are classified as coenzymes. They do not, let me repeat that, they do not provide energy directly, but without them, the energy contained in carbohydrates, fats, and proteins cannot be utilized. Vitamins are classified as water-soluble and fat-soluble. The water-soluble vitamins include vitamin C, or ascorbic acid, Where's a good source of vitamin C? Fruits and vegetables. The B vitamin family, including thiamine and niacin, are also water soluble. We generally think of the B family as being involved in meats, but they're also found in other sources of our diet. Medical problems can develop with deficiencies in any of these vitamins. The fat-soluble vitamins, vitamins A, D, E, and K, are stored in large quantities. Deficiencies, again, can cause medical problems. Toxicity has been known to occur with overconsumption, again, especially in vitamin A. Minerals are involved in bone strength. Calcium is an excellent example. Calcium also assists in muscle contraction, and sodium is involved with nerve excitability. They are involved in hormone synthesis and play a role in oxygen transport within the blood. Minerals are classified as macro minerals, such as calcium and sodium, and micro minerals in smaller quantities, such as iron and iodine. Water. Water is probably one of the most important nutrients, and yet is sometimes even forgotten as a nutrient. As humans, we do a very poor job of consuming water. What are water functions? A medium for all biochemical reactions. The chemistry of life cannot occur without water. Transport of nutrients and waste within our bloodstream, considering that majority of our blood is made up of water. And thermal regulation. Dehydration is one of the most common causes of acute decreases in sports performance. Remember the last time you were sick and had problems with vomiting or diarrhea and how weak you got. That's a very, very quick example of where a major loss of water in the body can leave you feeling weak and achy. Most people are chronically dehydrated. So as athletes, we want to make sure that we're consuming lots of water. The next part of my talk is going to be basic nutritional needs of normal, healthy individuals. What we're going to look at really is the amount of carbohydrates, proteins, and fats that you need to take in your diet. And we'll base them on percentages. Carbohydrates should be the highest percentage of your caloric intake, between 50 and 55%. This isn't too hard to do. Protein, while generally a controversial subject of intake, should be between 15 and 20%. Some athletes believe that it should be higher, and in some conditions I agree. Fats are also controversial in terms of how much. It seems like most everybody's trying to say how little, but we want between 25 and 30% of your caloric intake in the day. How do we calculate caloric intake and how much energy is associated with each of the carbohydrates, proteins, and fats? Well, first let's recall from earlier in the talk where I gave you the caloric value of 1 gram of carbohydrate being equal to 4 kilocalories of energy. 1 gram of protein being equal to 4 kilocalories of energy, and fat being nearly twice as much at 9 kilocalories per gram. Well, does this mean that we preferentially burn fats because there's more energy associated with it? No, but we'd like to. Well, let's see how we can use these numbers and percentages found in the diet to determine how many calories of energy you consume during the day. Let's use this example, 2,400 kilocalories per day in the diet. And if we have 300 grams of carbohydrate being taken in this diet, how many calories are associated with those 300 grams? First of all, we want to multiply 300 grams of carbohydrate by its caloric equivalent of 4 kilocalories per gram, giving us 1,200 kilocalories of carbohydrate stored energy. If 1,200 kilocalories as carbohydrate are divided by the 2,400 kilocalories total, we find that 50% of the diet was carbohydrate. Using these formulas, we can determine any caloric value determined to percentages found in foods. What do we want to know about proteins as part of our diet? Conventional wisdom tells us that we need about 0.8 grams of protein per kilogram of body weight, regardless of male or female. Research to date would indicate that in athletes requiring larger lean body masses, this may not be enough, and the numbers may rise above 1 gram per kilogram of body weight. Most athletes consume much more than 0.8 grams of protein per day, and so this may not be much of an issue. However, high protein diets or overconsumption of protein at the expense of carbohydrates and fats may result in protein being stored as fat. And remember, protein is not a primary source of energy. Carbohydrates. How much? How often? Despite intake, the body only has a limited storage capacity of carbohydrates, primarily stored in the liver and in the muscle. The range generally of 5 to 8 grams of carbohydrate per kilogram of body weight is used. However, we do set a minimum of 200 grams per day. Fats. You're going to hear lots of information in the media today, reading in magazines and watching television, of either that your diet should contain primarily all fats or just the opposite, no fats at all. The jury seems to be out on both of these fad diets at the present time. However, we will recommend, again, that fats be at least 20 to 30% of your normal diet. Low requirement of 2% of your daily calorie intake will provide necessary, essential fatty acids. And the World Health Organization and the American Heart Association both recommend that not less than 15% of your daily caloric intake be of fats. Vitamins and minerals. How much do we need? We generally turn to what is called the recommended daily allowance, or the RDA, and this will be listed on all food packaging. Intakes exceeding the RDA have not been proven to be performance enhancing in healthy individuals. In fact, no scientific evidence exists today that taking excess vitamins and minerals will help in any way, shape, or form in performance enhancement. Intake should range between 67 and 500% of the RDA. Water. I mentioned earlier that in athletic performance, water, along with carbohydrate, are two most important nutrients. It is generally recommended that 1 milliliter of water per kcal of energy expenditure for adults be consumed. In other words, you've got to have water for the body to produce energy. Now, how can we tell when we are generally hydrated? And remember, I've told you that most adults are chronically dehydrated, meaning that we don't take in enough fluid. Here's two things to look for. Frequent urinations, at least 4 times per day. But the number of times you urinate throughout the day must be in relation also to what does the urine look like. Normal urine should have a lemon-like color to it, pale, and there should be a fair amount. If your urine is dark yellow, small amount, and generally has an odor to it, this is a good indication that you've either consumed too many vitamins or that you're dehydrated, or both. 1 pound of body water lost as sweat equals 1 pint of fluid needed to rehydrate at the minimum. Again, most athletes are not consuming enough water. Thirst is a poor indicator of whether or not we are properly hydrated. Most of us go to drinking fountains and take a couple of quick slurps, and the coolness in our mouth seems to alleviate the need to drink any further. I would recommend that normal individuals, and especially athletes, carry water bottles with them on a daily basis. Drink at least half of your small water bottle at any time. This will ensure that you're properly hydrated. Now let's look at nutritional factors affecting sports performance. I have categorized these in 4 ways: aerobic endurance athletes, muscle mass hypertrophied athletes, strength/power athletes, and cross-trained multi-sport athletes. You may fall in one or more of these categories, and the actual nutritional needs do not vary greatly. First, aerobic endurance athletes. What do we think of? Long-distance runners, cyclists, swimmers, events certainly lasting for more than an hour. If we think of carbohydrates as the primary source of energy, then naturally carbohydrates should be higher than all the rest. I recommend 55 to 60% of the diet being carbohydrates, fats around 30% as a potential energy source, and protein a little lower or at the recommended levels of 15%. Remember, none of these are written in stone, and your diet may vary. However, if you're consuming more fat than you are carbohydrate and expect to be an efficient aerobic athlete, you're sadly mistaken. Muscle mass / hypertrophied athletes. We're looking at individuals whose sports needs require lean muscle mass of large proportions. I think of football linemen and weightlifters, powerlifters, Olympic lifters. Again, energy still at 50%. Many of us don't associate carbohydrate burning with weightlifting. However, again, it's still the major source of energy. But the energy required for training for these sports or competing in these sports is much, much less and at the opposite end of the aerobic athlete. So I recommend carbohydrates at around 50%, fats at around 30%, and protein at 20%. Although, if you are a hard gainer in terms of muscle mass, you may consider upping the protein and dropping the fats. I would not, however, sacrifice the carbohydrates. In our female athletes, we really find that it's difficult to get them to consume this level of protein. And so as a trainer, as a coach, as an athlete, I might remind the female athletes, try to consume more protein. Strength and power athletes, how do they differ from increased muscle mass athletes? I've divided them out based on energy needs. And I've thought of rowers, throwers, or other track and field athletes, and cyclists in this category. Higher energy needs, so higher carbohydrate needs, 55%. Fats at 30% and proteins at 15%. However, if you are a power athlete that has trouble maintaining muscle mass, you might increase to 20% of protein and drop your fats down to 25%. Cross-trained multi-sport athletes can basically eat all day in between training sessions. I think of these as the triathletes. Carbohydrate needs are going to be upwards of 60%, and in some cases even higher. Fats at 20%, and possibly protein at 20%. Remember, with a cross-trained multi-sport athlete, we're generally looking at 2 training sessions a day. So eating is going to be of utmost importance. In between training sessions, athletes really need to consume more calories. When it all comes down to it, though, there are no magic foods. There are also no bad foods. There are bad times to eat and bad amounts. But when we look at the needs for athletes, carbohydrates and water are the most important nutrients. Again, it's easy to see this carbohydrate need, but oftentimes water is still neglected. Metabolic expenditures, not accounting for athletic movements, of just existing for an individual might be 18 to 2,700 kcals a day. In other words, laying on the couch using that thumb just to push the remote button. But when we get into needs for athletic performance, in the athletic world, expenditures could be as high as 6,000, and in something like the Tour de France, upward of 10,000 kcals a day. How long do your energy sources last? Your primary source of energy, again, comes from carbohydrate stored in the muscle as a form of glycogen. The liver also stores carbohydrate as glycogen. The liver has a tendency to hang on to its glycogen stores until they're absolutely needed. In a well-trained aerobic athlete, carbohydrate stores in the muscle will be wiped out in about 4 hours. This means that carbohydrate which you brought to the event, stored in your muscles, is going to be pretty much gone in about 4 hours. So if your events are going to be lasting even longer than that, you're going to have to be eating. And certainly in an event lasting 2 or more hours, you're going to be looking at taking in carbohydrate nourishment along the activity. A good example is, again, the triathlon. Now, once you're wiped out, once you've lost that glycogen, how long does it take to get the muscle's stores back to 100%? This may surprise you. It takes 48 hours. Oftentimes we think that if we pop a candy bar or a high energy drink into our mouth right before an activity, that which we just ate or drank is used. That's hardly the case. We've all had that feeling, which we call the heavy feeling, where the legs start to feel like tree limbs. We sometimes call it the monkeys jumped on our back. That point in an event where we just feel that we can't go any further. Sometimes it sneaks up on us. But for the well-trained athlete, we have an idea based on past performances when we're going to get tired. The graph that you're looking at now shows 3 things. It shows the amount of energy on the left-hand side as muscle glycogen. On the right-hand side, we're using a scale of exhaustion from very light to completely exhausted. On the bottom, we're looking at the amount of exercise time in hours. If we look at the 2 lines, one being the amount of glycogen used and the other the amount of perceived exhaustion, we see that they intersect at about an hour and a half, meaning that most trained individuals will have plenty of muscle glycogen and will not feel the effect of the exercise till we get past about an hour and a half. And then we see what happens to the use line, which continues to drop off, and then a very rapid rise in the exhaustion, meaning that this is an exponential amount of rate, that this happens very quickly, and it needs to be tested by the athlete in numerous trials to determine when exactly are they going to feel tired. Now, the greater the training, the more we can move both lines to the right, meaning we can go longer, we can store more, and we can feel less tired the greater trained we are. The untrained individual is going to move to the left, and we're going to use up muscle glycogen quicker, and they're going to be able to go shorter distances, and the amount of exhaustion is going to be greater at any given time. Again, this is a trainable effect. We've been hearing for many years about a positive effect of a low carbohydrate and high protein diet. In the 70s, Dr. Robert Atkins came out with his still controversial diet, which tells us all that we should eat lots of fat, lots of protein, and avoid carbohydrates. Well, what happens if the athlete takes this advice? The graph on this slide of work done at Ball State University shows the effect of exercise on a low carbohydrate diet. Highly trained endurance athletes were asked to run 2 hours 3 different times during the week. They had 2 days of rest between each trial. If we look at what happened on day 1, the athletes came in, they ran, their muscle glycogen expectedly dropped, and no one said that the run was very hard. Instead of giving a high carbohydrate meal, which would normally be the fashion, these athletes were then fed a high protein fat diet. They came into the laboratory again. We were able to determine their glycogen levels through muscle biopsy techniques. We find that they are about where they left off. Nothing happened. And we asked them to run again. Again, these were highly trained athletes, and their motivation level was high. They completed the runs, but with some pain, some discomfort, and some typical athletic grumbling. Again, they were not fed carbohydrates, but a high-fat protein diet, and once again asked to come in and run. Again, through muscle biopsy techniques, the amount of stored glycogen was determined prior to the run, and we can see that they're at very, very low levels. Remembering the previous graph, this is where most people started saying they didn't want to exercise at all. But again, these athletes were motivated, and we asked them to complete the trials. They all completed the trials, but they all were in great pain and discomfort. Muscle biopsies at the end of that 3rd trial show that they were critically low on muscle glycogen. Asked if any of them would want to come in and do a 4th trial, we got no takers. Well, you can imagine what's coming next. What if we take the same group of athletes, give them plenty of rest, and ask them to come in and perform this same training exercise routine, but with a high carbohydrate diet? Again, we don't see much difference at the end of day 1. They dropped to about the same level, and there were no complaints about the run. We now fed them a high carbohydrate, low protein fat diet, much like I've been recommending, and asked them to come in for their second trial. Muscle biopsies show almost, after 48 hours, a complete restoration of muscle glycogen, meaning that with all else equal, the athletes should perform quite well. And sure enough, at the end of the second trial, we see that they've dropped, but not to the point where they were in tremendous discomfort. Again, these were highly trained athletes that a 2-hour exercise bout was typical for them throughout the day. On the third time we came in, they were slightly lower, which is to be expected, but certainly not anything that would cause them any trouble. They dropped slightly lower, and when asked if they could come in for a fourth trial, which was not done, they all said sure that they would. So I tell you that the evidence is right in front of you. You don't have to be a world championship athlete to see the effects of a low carbohydrate diet on your day-to-day workouts or even just your lifestyle in general. While these diets may provide some immediate weight loss, we want to examine all the science before we make a dynamic switch from high carbohydrates for athletic diets. Well, what should we eat? We look at a pre-competition meal, and while this is generally, from my experience, been based on my own work with football teams, it can be put to just about any sport activity or sport event. Eat 3 to 4 hours prior to the competition. Select meals that the athletes like. This is not a time to be experimenting with different foods. If you can't get them into it, the athlete, it doesn't matter how good the food is, it's not going to provide any energy. Also, select meals that are well tolerated by the athletes. Something that's not going to provide a lot of gas, something that's not going to stay in the stomach for a long period of time. Select meals that the athlete usually eats prior to competition. In other words, let's stick with what works and select meals that the athlete believes will enhance performance. Sometimes a placebo, while being a placebo, can still have a positive mental effect on the athlete. Eating after exercise is probably more important than what you eat prior to exercise. Remember, I stated earlier, that candy bar that goes into your mouth right before you go to exercise does little to enhance performance. But we do know that if we want to compete on a regular basis, and in some cases back-to-back performances, such as basketball and baseball, we need to be thinking about not 1 day's performance, but 2 days' performance. Scientific evidence clearly shows that the muscle membrane is most permeable to carbohydrates and proteins within 2 hours after the event. This is a time we want a carbohydrate with a high glycemic index. Remember, the glycemic index is that relationship between the sugar in the blood and how quickly the insulin can remove it. And in this case, because the membrane is sensitive to carbohydrates and proteins post-workout, we want to get the carbohydrates into the membrane as quickly as possible. Proteins have also been shown to enhance glycogen, or the storage capacity of glycogen, or what is called replenishment. And again, intake of plenty of water. Final part of today's lecture is on performance-enhancing ergogenic aids. I want to begin by saying that a poor diet supplemented is still a poor diet. What are nutritional ergogenic aids? It may be a deficiency of any nutrient in the body could cause an impairment of athletic performance. In other words, an endurance athlete that takes in too few carbohydrates may have a problem. And in this case, we might consider carbohydrates themselves an ergogenic aid. However, most proposed nutritional ergogenic aids have been shown to produce little or no benefit to athletic performance in controlled research. However, through the last 2 decades, the sale of nutritional supplements for sports performance is a $1 billion a year industry. The categories of ergogenic aids that I'd like to talk about include anabolic steroids, nutritional supplement, blood doping, carbohydrate loading, and some nutritional stimulants. When a group of Olympic marathon runners were asked if they could take a pill to ensure a gold medal in their event, but die the next day, they all said they would take the pill. While startling, this shouldn't surprise any of us that we're all looking for a magic way out. Wouldn't it be nice to have only had to exercise once in your life and then have a great body, not have to worry about what you eat, not have to worry about going to the gym day in and day out? Can the answer really be found in a book or a magic pill? Sorry, it's not out there. The true simple fact is that we need to eat less and exercise. Well, let's go through some of these things that possibly do work to enhance performance, but in the long run, many things that do not. I'd like to think of the true ergogenic aids as anabolic steroids and growth hormone. Pictured here are some anabolic steroids and masking agents used to cover up their use. Nearly all sports, professional, Olympic, and collegiate, ban the use of anabolic steroids and growth hormones. And yet, every time we look at the sports page, we see somebody else's gold medal, somebody else's world-class record, or somebody else's classic athletic character being attacked because they have tested positive for the use of these substances. Well, let's define anabolic steroids. Anabolic steroids are synthetic compounds, in other words, something that's made by the drug company in a pill or injectable form. They also come now in gels, which have a testosterone-like action. As a quick review, testosterone is the male hormone responsible for increased muscle mass and the secondary sexual characteristics of the male. Scientific studies now show without question that the use of anabolic steroids in conjunction with high-intensity progressive resistance training increases lean muscle mass in males and females. It is also responsible for a great amount of water retention, that puffy look, or the ability not to get your ring off your finger after you've had too much water and salt. It also causes a masculizing effect in females. Generally, this is noted by an increase in facial hair and a deepening of the voice. These items are reversible when the individual stops using these drugs. In males and females both, the more dramatic negative effect of anabolic steroid use is its effect on the blood lipid profile, with the negative effect on high density lipoproteins. There's also an increased risk of prostate cancer, especially those individuals who may be predisposed to prostate cancer to begin with. In other words, does your father, your grandfather, your uncle have prostate problems? And again, as noted earlier, anabolic steroids are banned by nearly all recognized sporting bodies. Well, growth hormone, not to be put into the exact same category as anabolic steroids, does have a tremendous and profound effect upon the body's growth. It's a protein secreted by the anterior pituitary gland. We all have it, males and females alike. Once you have reached adult stature, however, you just get a little bit of growth hormone released during your sleep. It's kind of a catch-all self-repair hormone. Travels around the body through the bloodstream, generally repairing muscle tissue, skin tissue, things that have little minor breakages in the body's tissues. It does have an effect of increasing the size of all body structures. A rampant growth hormone released throughout childhood and into adulthood results in gigantism. Synthetic growth hormone has now become available, and while it is very, very expensive, it has not deterred the use of growth hormone by athletes. Again, athletes seeking for increased lean muscle mass. Excessive use in normal individuals may lead to a condition called acromegaly, which is an enlargement of cartilaginous tissues and causes them to grow. Knuckles enlarge, the brow above the eyes enlarges, nose tissue enlarges, the jaw enlarges. It is a disfiguring disease, and it is disfiguring to athletes that have used growth hormone on and off over several years. To date, it is difficult to test for growth hormone in the blood. Again, like anabolic steroids, growth hormone is banned by nearly all sporting agencies and bodies. Why do we want to get the muscle bigger? What effect does it have? Well, we say if muscle gets bigger, then you get stronger. Simple as that? Sure, but what does it really mean? What's getting bigger? What's getting stronger? And why do we take these drugs to get bigger and stronger? Well, one of the things that we have found through recent abilities to do single muscle fiber research is that actin, you remember it, and myosin, the two contractile proteins within the muscle, lay next to one another. And if you kind of imagine the actin as a chain of beads and as the myosin as long strands with little hooks on them, we think about that thing called the cross-bridge connection, where the myosin reaches out, grabs onto the actin, and pulls it back. A simplistic reminder to the very complex nature of muscle contraction. However, it has been found that there's an optimal spacing between actin and myosin. And if there's dehydration of the tissue, that affects the spacing. When the spacing is not at an optimal level or an optimal distance, the muscle gets weaker. And so we have found that the muscle wants to be fully hydrated. A fully hydrated muscle fiber is stronger than a dehydrated muscle fiber. It also helps us explain why we get so weak with massive dehydration and why we can get so strong so quickly with substances like anabolic steroids and growth hormone, which increase water retention. Well, some of our proteins supplements cause cell volumization also. Creatine monohydrate is one such product. Creatine was initially marketed to increase stored energy in the muscle. In a moment, I'll remind you of where creatine phosphate falls into the energy scheme of contracting muscle. When we take a substance like creatine, we find that the body primarily the muscle tissue, holds more water. And therefore, creatine supplementation has been found by strength athletes to not only increase their muscle mass, but also increase their body weight, along with significant strength increases. To a lesser degree, carbohydrates will cause water retention, but creatine and another protein, glutamine, have a great effect on increasing cell hydration. Do you have creatine in your body right now? Sure you do. It's naturally occurring protein found in meat. You have to be on a very restricted diet not to have creatine show up in the foods that you eat. It is involved in energy production, but the body really is never at an absolute loss, and has been found through numerous scientific studies. The increase of creatine monohydrate into the diet has not had a tremendous significant effect on energy production. However, we did find this interesting relationship between creatine and water, and research supports the use of creatine for strength production. It also has shown that a total body weight, bench, and squats will increase significantly with the use of creatine. It is generally recommended that 5 grams per day is needed over a 12 to 16 week, highly intense progressive resistance training protocol. I might add in from my own research that athletes over 220 pounds may consider taking more creatine, up to 7 grams a day. And if you're an athlete that pushes the needle beyond 300 pounds, 10 grams a day may be needed. Might also remind you that since creatine is naturally occurring, it's found in food. If you're a big red meat eater, you may have little or no effect by the excess creatine that you take. And let's keep in mind that all nutritional supplements have responders and non-responders. So if you're a person that's deciding to use creatine and you're getting good results, there doesn't appear to be a tremendous amount of problem with you keep taking it. The only long-term studies that have been done have been only over several weeks. So there's no safety guarantee that using creatine over long periods of years may not result in some medical problems. However, that evidence is yet to be shown. Glutamine. I consider glutamine to be one of the hottest amino acids on the market today. It has a similar volumizing effect as creatine. It has no known side effects from long-term use. Your body muscle is loaded with glutamine, but shows a significant glutamine loss during high-intensity exercise. Glutamine, unlike creatine, then is actually used by the muscle, whereas creatine seems to be somewhat of an onlooker. It's thought to promote an anabolic state in muscle cells and decrease exercise-induced immunosuppression. In other words, when you exercise really hard and you do some damage to the muscle, there are certain enzymes released that are indicators that the muscle's damaged. And what you'd like to be able to do is suppress those enzymes so that there's a greater healing power of the muscle. Glutamine is an excellent cell volumizer. Branched-chain amino acids. Remember, we looked back on our proteins in general, and we talked about the essential amino acids. The branched chain, of which there are 3, are part of the essentials, meaning that you have to eat them. You have to take them into the body somehow. Consists of valine, leucine, and isoleucine, of which leucine seems to be the major branched chain that the other two work with. There is some evidence to show that they promote an anti-catabolic hormone profile. In other words, after a large exercise bout where there's some muscle damage, if we have excess branched-chain amino acids taken in through supplementation, this seems to have a positive effect on blunting this catabolic effect on the muscle or the breakdown. Branched chain seem to minimize the degradation of muscle proteins during intense exercise. Most recovery products nowadays contain branched-chain amino acids. There is no evidence of any long-term medical problems from the use of branched-chain amino acids. Here's a mouthful for you: beta-hydroxybeta-methylbutyrate, HMB. It's a product that is getting a tremendous amount of look-see now by older individuals. The research that is going on today at the Aging Institutes and at Ball State University also has shown that there is a possible relationship between the use of this supplement and aging individuals over the age of 50 with strength training, that it has an effect of inhibiting protein breakdown and actually causing a greater increase in lean muscle mass in aging males. The verdict is still out on this. Well, one of the big questions always is if you take something in by mouth and it goes through the digestive tract and is picked up into the bloodstream and delivered to the cell, primarily the muscle cell, does it ever get there? And if it does get there, does it ever get in? Can it get through the cell membrane? And so some nutritional supplements try to act like insulin. Remember, insulin is our key to the cell membrane primarily for proteins and carbohydrates. It has been suggested with little scientific evidence to no scientific evidence that at all that alpha lipoic acid, chromium, and vanadium sulfate taken in supplementation will have a insulin-like action on the cell membrane. Personally, I haven't seen the evidence to support the use of any of these products. Androstenedione. Its popular name is Andro. It is an over-the-counter pro-male hormone. What do I mean by that? It is a step or two away from becoming testosterone. It is a testosterone wannabe. It is naturally produced by the male testes and the female ovaries and the adrenal cortex in both males and females. Recent research showed no increases in testosterone levels or testosterone action in young males that take androstenedione, and furthermore showed a potential hazard with using these drugs. They do increase testosterone levels in females. Androstenedione has been banned by the NCAA and other sporting agencies. It has been said that for a young, active, healthy male to take androstenedione in an attempt to increase testosterone levels in the blood is like putting a drop of ink in the ocean and expecting it to change the color of the water. DHEA falls into the same categories as androstenedione. It is a hormone produced by the testes and the ovaries, and the adrenal cortex in both males and females. This one appears through the research, and there's just more work with this, but it appears to have a testosterone-like effect in males over 40 years of age. In other words, increasing the amount of testosterone that's available. Its effect may be more profound in females, and it is banned by the NCAA. Glucosamine. Glucosamine is a supplement that started off with no one thinking that it did any good. And then some research started to be put out about glucosamine until there are a flood of scientific papers showing the efficacy of using glucosamine. Well, what are we going to use it for? It is needed to produce proteins which help bind water to the cartilage matrix. Well, what do I mean by that? There's little pads of cartilage that cover the ends of the long bones of the body. When you stand up, the reason that we can stand up without much pain and without much noise is that covering the end of our femur and the top of our tibia are pads of cartilage. They absorb fluid, and when you stand up, they act like little shock absorbers, and there's no bone on bone, thus no pain. As we age, this cartilage starts to wear away. 50% of all Americans over the age of 45 have some form of cartilage damage. When bone touches bone, it's extremely painful, and we call it osteoarthritis. You might notice it in the hands of your grandparents or the elderly members of your family. Then it moves to the knees. Then it moves to the elbows and the shoulders. And it's very, very painful. Glucosamine can be used as a proactive nutritional supplement. Studies to date show that the use of glucosamine on a daily basis, year in, year out, may be a way of decreasing the onset of osteoarthritis. Glucosamine is also needed for the stimulus of increase of chondrocytes. Chondrocytes are cartilage cells that are needed to repair cartilage. If we can repair little changes in our cartilage on a daily basis, it may result in more long-term healthy cartilage, especially for those of us that have been involved in athletics throughout our lifetime. Carbohydrate loading's been around for a long time and needs to be talked about in a historic manner, because nearly anyone who competes in long-term aerobic activities plans to carbohydrate load before the event. It enhances the storage of muscle glycogen in the muscle 20 to 40% above normal, even in highly trained athletes. And what we do is we rest. A horrible thing to say to athletes. We taper. We back off on our exercise 1 week prior to the event. And then we consume diets high in carbohydrates 3 days prior to the event. 8 to 10 grams per kilogram of body weight for those of you that are counting, or just double the recommended daily amount from 300 grams of carbohydrate up to 600 grams. Those that carbohydrate load definitely have an advantage over those that don't in long-term exercise, and thus, from the standpoint of definition, can be considered an ergogenic aid. Blood doping, a very dangerous practice, but one that still gets the newspapers year in and year out, and even more so in years with the Olympics. It's a technique used to artificially increase red blood cell mass. In other words, the amount of red blood cells that you have in your body. So what? Why do you need more red blood cells? Well, let's just review. Remember that it's the red blood cell that's going to carry oxygen. Oxygen is needed to be successful in highly aerobic events. If we have more little red blood cells carrying more oxygen, we're going to have more oxygen available for exercise, and thus enhance our competition. Now, how do you blood dope? Well, one way is to infuse red blood cells of your own prior to aerobic endurance events. In other words, 2 months before you're going to have an event, you have blood drawn from your body, the red blood cells stored and frozen. You have 2 months to recuperate. You're at your normal level, and then a day before the event, re-inject the red blood cells into your bloodstream, automatically increasing the amount of red blood cells. This is the most typical way that individuals blood dope. And you can see that there's a certain amount of medical technique needed here to do this. Let's remember, it's illegal. Now, you can also train at altitude to blood dope. In other words, if you have competition at sea level and you train at altitude, altitude is a stimulus for red blood cell production. So if you have the ability to go to altitude, train for several weeks, come back to sea level and compete, you will have an advantage over those who have not trained at altitude. Well, of course, it wouldn't take long before drugs were developed to do this same thing. Why would you want drugs to enhance red blood cell production? It's very important for cancer patients that are getting chemotherapy to get drugs to keep their red blood cell count up. And so using these types of drugs, one such drug is erythropoietin, injected into a normal individual, increases the red blood cell mass. This can also be deadly. European cyclists have used EPO to such degrees that they've actually turned their blood to molasses, or the thickness of molasses, and literally died. There are many health risks associated with blood doping, and again, it is banned by nearly all sports bodies. Caffeine. Surprised to see it on the list? Well, you shouldn't. Remember, caffeine's a powerful drug. It's in the foods that we eat and the beverages that we drink. Caffeine is a stimulant, and it's, again, naturally occurring in food. When does it become illegal? How do you take a cup of coffee and become banned by the Olympics? Well, you don't. Blood levels need to exceed 12 micrograms per milliliter to be considered caffeine doping. Well, why would we ban caffeine to begin with? Well, it's thought to delay fatigue and increase alertness. That's why most of us think we use caffeine. It also has been shown by some research to have a glycogen sparing effect. Again, what do we mean by that? Well, the glycogen is the stored form of glucose. It's going to be used while we exercise. Fat is burned in the flame of carbohydrate. So if we can spare the amount of glycogen being utilized, we might increase the amount of fat mobilized. And then at the end of an event, possibly have a little more glycogen for that kick, that little extra need at the end. Well, one of the problems is that this doesn't work with everybody. And some people say it doesn't work at all. And in most cases, you have to be a true responder to caffeine. The effect of increased caffeine use is chronic dehydration. I want to go back to what we mentioned earlier. If the muscle's dehydrated, you're weaker. If you're chronically dehydrated, then maybe you've never experienced the true strength of your musculature. The more caffeine you consume, the more urine you produce. It is considered a mild diuretic. In other words, its medical use could be to cause you to form urine, to get rid of water. Where's that excess water coming from? It's coming from your muscles, which are primarily 70% water. If we're consuming more caffeine, we lead to more and more dehydration. Here's another connection that's often made by young people. We consume large amounts of alcohol and we become dehydrated. We end up with what's called a headache or a hangover. To cure the hangover, what do we generally do? Go get something that's got caffeine in it. Now we make the dehydration even worse. And for the athlete, this can be detrimental to performance. Caffeine is addictive to most individuals. If you drink more than 2-3 cups a day, try stopping. If you get headaches from it and you can't stop, you're mildly addicted. There are other caffeine-like products or stimulants that are now being found in products being marketed to both athletes and the general public. Some products may contain guarana, a distant relative to the coca plant, ginseng, and until recently, ephedra, a stimulant which has now been banned by the FDA as an over-the-counter product. Your stimulants of choice should not contain ephedra products. It is interesting that there is no research to date on the interaction between caffeine and other stimulants in over-the-counter products. I would consider that most young people should try to decrease the amount of caffeine and caffeine-like products. And as an athlete, trying to cut back on the amount of caffeine that you're using simply from a dehydration standpoint. The less caffeine you use, the more water you'll have in your muscle, and the stronger you'll be, and your performance enhancement will be greater.
This concludes the Sports Nutrition Concepts and Applied Strategies presentation.